Good morning, everyone. Thank you for joining Understanding Systems of Care in New York State, What Schools Need to Know. My name is Amy Malloy, and I'm the Project Director of the School Mental Health Resource and Training Center. We are a project of the Mental Health Association in New York State. We were established to help schools comply with mental health education law. And in our conversations with schools, some of the questions that have come up have been around the kind of resources that are available at the community level. So we're really excited today to be able to partner with the Office of Mental Health. Angela Keller, Project Director of New York State Systems of Care Pilot, is joining us to host this webinar and give us some really great information about the Systems of Care framework and how that might apply to schools. I also want to mention and give credit to the New York State Mental Health Advisory Council. This council was convened shortly after the law was passed to develop a plan to help schools implement mental health education. And that advisory council consisted of pretty much any stakeholder you could think of in New York State. We had representatives from the School Social Work Association, from school psychologists, school administrators. It was a very robust team that worked really, really hard for months to release a document that provided information to schools about how to implement the mental health education law. And the last time we met at the end of the spring, one of the questions came up related to resources in the community, and what we had been hearing was a framework called Systems of Care, and we all kind of wondered, what does that mean? How does that impact schools? What do schools need to know? How can that support schools' efforts to promote mental health and wellness among their students? And in conversations with the Office of Mental Health, they graciously agreed to offer a webinar to schools. So we are really happy to have this opportunity to share this information with you. It will be recorded and it will be hosted. It'll be posted online, and information will be shared with the education community. So if you found this helpful, please share it with your colleagues, and so they can benefit as well. So with that, I'm going to turn it over to Angela, and you're welcome to put any questions in as we go along. We'll monitor those, but for the most part, they'll probably be answered at the end if anything didn't get kind of answered in the meantime. So thank you, Angela.
Okay.
Thanks for joining us.
And we understand some folks are having difficulty with the audio, that the connection keeps spinning as if it's trying to connect, and then you're hearing a continual, this meeting is being recorded, playing over and over. We're not hearing it on this end, so I'm hoping it stops. So we'll give it a try, and we'll see what the recording turns out at the end. So I want to start a little bit talking about New York's history with system of care. The Substance Abuse Mental Health Services Administration of the federal government coined this term system of care, or they then, some researchers coined the term, and then SAMHSA began funding system of care grant initiatives to help states and communities and territories across the country implement this framework. And the first round of SAMHSA grants were released in 1993. New York received its first one in 1994 in the second round of funded programs. And that was actually originally, OMH was the first one in the state. And then since then, there's probably been about 15 other counties that have received system of care expansion grants. And right now, we're having some challenges. Hang on, folks. Okay. Hang on, folks. Can people still see the slide deck? If somebody could, it looks like control of the.
No slides.
Control might have switched to somebody else. Okay, so can folks see the slides? If you could just give us, okay, great. So let me enlarge the screen, and hopefully that'll, there we go. Okay, so New York State Office of Mental Health received a statewide system of care grant in 2016, and it's had two components. We've been piloting an evidence-based practice model, high-fidelity wraparound within health home care management, and we've also been leading and supporting statewide system of care implementation, which is what I'll talk about today. Also of note, the New York State Education Department in 2018 received a Project Aware grant from SAMHSA in collaboration with the Office of Mental Health, which they're implementing in Buffalo, Brooklyn, and the city of Rensselaer. And within the context of that project, we're overlaying the system of care framework. So between those three school districts, we're hoping to have some ways in which that could be replicated from a school system out to the community as that project continues on. Okay, defining systems of care. There's a long explanation of what it is, but really in short terms, it's a coordinated network of community-based services and supports for children and youth who are experiencing challenges and their families. Originally, it comes out of the mental health field, but over time, there's been a recognition that children touch many service systems and have complex needs, and so system of care is really much, much broader than the mental health system. And so it's really, how does a community take care of its own? So take care of its own needs and challenges and populations and children. And so it's an organizational framework really for systems change and reform. It's based on a value base at its foundation for systems to communicate with each other and deliver services, and ideally that would be adopted by all systems. It's a guide to implementation, but it really can be made unique to state, county, or community. It's adaptable, given the environment. It's really flexible, and it can be applicable and targeted towards different age groups, levels of need, or even cultural groups. So again, it's a framework. It's not a program. It's not a clinical model. It's not a mandate, but it's a way in which we can look at how we might work together and network on behalf of children. So why system of care? So over these couple of decades, SAMHSA has, through its grant projects, gathered a lot of data. There's been a number of research projects across the country, and they've really proven that if the framework is used well, it promotes wellness of children and youth across a lifespan. It enables systems to share resources and responsibilities and collaborate well together. Communities can look at where are the gaps potentially in services and how can they put their heads together, and also financing together to either develop or enhance appropriate services and supports. And really at the core of this is how we engage and support families at all levels of the system of care. So what do schools need to know? System of care provides a structure for achieving health and wellness across all systems, which ultimately, as you all know, would support children's academic success. There are language differences, but a lot of the core philosophy of the systems of care framework has a lot of the same aims as the community school model and aligns well with MTSS. And as you look at the little diagram on this slide, really spanning from universal to those children at risk and most challenged, it thinks of kind of the interventions related to that also in that similar pyramid model. The framework does require external partnering beyond the school walls, and this is not just to make referrals to community agencies, but it's really to sit around the table together and solve community needs together. So let's talk a little bit about the system of care framework components. It is philosophy, infrastructure, and services and support. So I'm going to start off with the system of care core values. The core values really should guide the efforts to infuse the system of care philosophy and our infrastructure and services and supports. And I'm going to go through the core values one by one. So family-driven. This assumes that families are the experts in their own lives, their needs, their goals, and those of their children. That the service provider, whoever it is, whether it's a school, a mental health provider, child welfare, are really not the expert in making decisions for the family. That the family gets to decide on what they need and what their priorities are. This core value goes another step further in that family representation and caregivers should have a voice on policy management and service delivery levels for all children in the community. So through their lived experience from accessing our service systems, they then provide that voice to guide what makes sense for children and families. The second core value, youth-guided, is right along the same vein as family-driven, where young people have the right to be empowered, educated, and given a decision-making role in the services that they are going to access. But similarly, it also means that if we are implementing this framework, we're committed to ensuring that young people have a voice at the table in the community with service delivery and governance. Community-based, this is really important. That we should be looking at a network of services and their availability to families that is community-based in normative, typical settings and in the least restrictive settings. And that mix of services should be coordinated, and that how those resources are used, really those decisions get made on the local level. Cultural linguistic competence. This value really means that we're being responsive to the cultural, racial, and ethnic differences of the populations that are in our schools, in our communities, and that as a governance body in these in the project and how we implement the framework, we're addressing whatever the structural barriers are that might impact or create disparities across groups. And importantly, we're looking at the individualized needs of every given family and child. And so whatever this approach is and however it's organized in every community has the ability to be flexible. And high-fidelity wraparound is a practice model that's evidence-based, and that really is one of the best evidence or of being an individualized planning and service delivery way of going about coordinating services. The other core value, evidence-based and community-defined services, is that it's important that we provide services using the best research out there in terms of what are the best practices, what does the research evidence suggest that really is going to make the best difference in children's lives. And so participation in the local system of care requires the partners to be committed to ensuring that these values of system of care are alive and well. So the philosophy also has a set of principles, and I like to think of the values being the foundation of system of care and the philosophy really being the action steps. So how are the values then, how might we see them? We might see them in there being a broad array of services, having least restrictive settings, that there's partnerships at all levels that include family and youth, care management, and so on. So the second component of system of care is infrastructure, and that really composes governance, financing, partnership, and capacity for planning, evaluation, quality improvement, and workforce development. So the 5 core areas of system of care implementation are on this slide. So really, as that, say, a county system of care looks at data, what's happening in their community, where are the things where there are gaps, where the community is struggling with, what might be the policy, administrative changes that could be made so that that system of care works better. What are some services that could be developed or expanded, and how well is the connection to care management happening? Is individualized approaches occurring across the system? And that system of care is really providing training, technical assistance, and coaching for the overall workforce in a community. And then generating support in an advocacy base is if you've got a collaborative, committed group of people that are implementing this system of care framework, their buy-in to this is really the voice on that this is a useful approach for a community to approach service delivery and development, and they really become your voice. And then the last area, which is certainly not the least important, is creating or improving financing strategies for whatever is implemented. So systems of care governance is really a decision-making body, should represent cross-systems, so county government, all your major service providers or stakeholders in a community, families and youth, which we'll talk about in a second, and all kinds of other stakeholders that might be part of that particular system of care. And so they're really the group that drives the vision for what the community system of care framework looks like, what its aim, and potentially what target population they might be concentrating on. And as I've said, really an undercurrent of this whole system of care framework is how do we include family and youth at all levels. So as you think about a system of care governance structure, how we might involve family and youth leadership really requires engagement, how you might train or mentor caregivers or young people to be part of governance structure, what are the tangible supports that might need to be put in place, such as stipends or child care assistance, times of the day that meetings are held, those sorts of things, and that we guarantee as those caregivers and youth may be sharing their stories and their experience that governance structure really has a commitment to privacy and confidentiality to whatever stories get shared. And that over time, that governance structure is really looking at how well you're doing in terms of family and youth involvement. So as you think about system of care infrastructure, your governance body, these are all the systems that we should be looking out to in a system of care to be involved. So that group collectively would come together in a particular community, identify needs, maybe set a mission or a vision, develop some strategies, and that governance body is really going to monitor and evaluate how well you're achieving particular goals. And maybe one of those goals is merely to engage the school systems throughout the community, and how might the system of care as an entire entity be helpful, mutually helpful for all parties. And as you see on the left, I just want to point out a couple things, civic and informal. So in order to really be a robust system of care infrastructure, think about the ELKs and other kind of civic groups that exist in a community who might fundraise, who might provide actual tangible things like back to school, help at the holidays, those kinds of things, and that they really should be involved in a system of care structure so that they can play a part in wherever the plan is going. Similarly, informal supports. So your faith communities, your library system, and other kinds of, maybe one-off, very small after-school providers, that sort of thing. So thinking of system of care as being very broad, not just a few mental health providers, DSS, a school district. It's really should be thought of very broadly. So some of you might be familiar in the counties in which your school systems reside of a model, the Coordinated Children's Services Initiative, or CCSI. This was implemented in the early to mid-90s and went on for about 10 to 12 years with state funding. Many counties established levels of infrastructure that were really the system of care governance bodies that still exist today. So you may have heard about CCSI or Tier 2. SPOA committee is sometimes another name that's used. And so where schools fit in, if you're not already at those tables, is to find out what are those structures in your communities. How could your schools, school districts, BOCES, be connected to these interagency governance bodies to problem solve together about what would be helpful to the schools, how can we connect the community to schools, and then vice versa. Could there be some partnerships that could then cross over everybody? So I wanted to also provide you with some examples that if you were to Google some of these, you will find online some explanation of what these local systems of care look like. And they all have very different structures, but are good models in terms of involvement of family and youth voice. The Essex Brief and the Yates System of Care Tier 2 are newer planning initiatives, and so they're still in the process of thinking about their membership and developing a plan. So those are some good ones just to reach out and look up. With the Westchester County CCSI, I am aware that there is a BOCES downstate that's really active and has been active in the CCSI in Westchester County, and that would be a good one to even reach out across school systems on what's the benefit been to that BOCES system that covers Westchester County. So the third component of services are services and supports. And so we're really looking at what is that broad array of home and community-based services and supports that at their very foundation have the values of the system of care framework. So they're individualized, coordinated, family-driven, youth-guided, and culturally and linguistically competent. And what I've inserted in here is the big picture, for example, of New York State's children's mental health system, which I will go into more detail on some changes that are happening in our system in the latter part of this slide deck. But any one system, whether you're talking about probation or DSS, education system, everybody is going to have their array of what is available in a system. Clearly, not everything is available in every community, but there is some access across the state for most of the models that we all implement. I'm going to pause real quickly here because I'm going to be departing from the system of care framework. So if there's any questions related to the framework itself before we move on, we can take them now. I understand and see in the chat box that there still continue to be some challenges with the audio. I really apologize for that.
It seems that those who have joined via the phone audio are having less difficulties, so that is always an option if you are still having problems. And we will be releasing the recording and the slides afterwards. So for those that may have missed pieces of it, okay. So one question is, one issue with these, at least downstate, is that there are so many of these places have wait lists and accessibility is limited. Any ideas? So I'm assuming you're referring to the array of services. That is a perfect
a question and dilemma for a system of care to wrap their heads around and think about in a particular community. What are the array of services that are available? What's the total population of children, youth, and young adults? Is that capacity enough to meet needs that school systems are seeing and community agencies are seeing? And if not, what are you collectively as a system of care going to do about that? And there's many different things that can happen. There's blending of funding. There's, certainly approaching the state about maybe a resource collectively being more of a regional resource versus a county.
There's also a question, Angela, about transportation and how some communities transportation is a big problem. Similarly, you might, find that as an issue in rural communities. So is transportation a good example of someone who should be involved in systems of care framework?
Absolutely. And in one county, and I'm not going to remember who, it's a rural county I've been speaking with, and one of the challenges obviously they have is a very large area. It's isolated. Service providers sometimes are far away from families that need help, and so they've been thinking about, are there volunteer driver kinds of arrangements that could be made? I want to say Sullivan County has solved the issue by engaging with a local community college or SUNY campus close by, and those students have become Uber drivers, and during their off hours between classes provide some transportation access for the community. Granted, that's still, somebody has to pay for that, but it has at least increased some access and creativity around how might you increase some, meeting transportation needs in a rural community. And there's plenty of examples like that all over the country.
Kind of what comes to mind is you mentioned role or, possible roles for civics kinds of organizations and groups. That might be a really good example of something they could get involved with.
Absolutely. Okay. All right. Well, feel free to keep writing any questions about the framework itself, but it's really a community way to meet the needs of who lives there, and by the collaboration of formal and informal stakeholders, families, and youth to make that happen. So the second part of this slide deck, what I want to turn to is kind of reviewing for those on the phone all the changes that have been happening in the children's system of care statewide. So if you haven't connected already or don't know what a single point of access is, in every county across the state, there is at least one staff person that is a single point of access coordinator, SPOA coordinator for children, that can be called to, you're maybe inside of a school, you've got a child that the child has an IEP, still struggling, some issues that are going on with the family, and you really want to try to get them hooked up with things. A SPOA coordinator in the county is a really good avenue for information, referral. Where do you go? How might you work with the SPOA to address the needs of a particular family? And so online, New York State Conference of Local Mental Hygiene Directors, on the right-hand side of their web page where it says contact local mental hygiene departments, if you click on that, this directory and map of New York State will pop up. You click on the particular county, and I don't have it active in this slide right now, but if you did, then it pops up and says who is the county commissioner or director, and then who is the SPOA coordinator, and often has their direct email link that you can just click on it, and also their phone number. So that's a really great place to go for that kind of information. As well, the SPOA coordinators often in many counties are the hub of the system of care. If they're not already coordinating an interagency group, some of them are in the process of getting that organized. So the other thing that has been occurring in New York State, so in the children's system, a collaboration across, as you see on the bottom of the slide, Department of Health, Office of Mental Health, Office of Alcoholism and Substance Abuse Services, Office of Children and Family Services, and Office for People with Developmental Disabilities. So these 5 state agencies have been collaborating, not everybody all together, since 2011 to design and implement a transformation to the Children's Service System and move services into managed care, create some new services that really serve to help us address needs of children earlier before they get to the need for out-of-home placement or residential placement and inpatient. And so one of these really important tools that we've begun to implement are the new Children and Family Treatment and Support Services, otherwise known as CTSF, because you know we have to develop an acronym for everything. And what they are is a set of 6 Medicaid state plan services that are mental health or substance abuse services or focused services for children birth to 21 who have Medicaid, and these services can be provided anywhere, at home, in the community, really wherever children and families feel comfortable. So schools can refer children to these services, can assist in providing that access, and as I'll touch on very briefly, because I didn't give you a whole lot of detail in terms of accessing the services, they really require a licensed behavioral health professional to make a recommendation that a particular child needs a service. So you have that capacity in schools with your social workers, your psychologists, et cetera, to make a clinical recommendation for these services and to help families get going on them. So briefly, the first 4 services, or first 3 services were implemented last year, I believe. Other licensed practitioner, community psychiatric supports and services and treatment, psychosocial rehab. And then a new service of family peer support services came on in July, and then I'll touch on 2 new ones that will happen this coming January. These services are not intended to replace what schools are already mandated to provide. They are an added set of services in the toolkit in communities to be able to meet children's needs earlier as they're exhibiting mental health and substance use issues. So family, group, or individual therapy can really be delivered in the home. If coming to clinic is a barrier, the clinic essentially can go to the child and family in their home. Community supports and psychiatric supports and treatment is supports in the community to help improve relationships and to really address some treatment needs that are going on in that family unit. Psychosocial rehab is relearning of skills for a child that may have lost them due to their illness or symptomology of their mental health or substance use diagnosis. And family peer support services are really critical in communities and can be so helpful to the families that may come to school guidance counselors or social workers asking for help, is that having a peer with lived experience who have raised their own child or is raising their own child with particular special needs can help that family navigate through the system and can support them as they do that. And many of you may have seen over time a family peer may come with a family member for a CSE meeting to advocate and better understand what is being planned for a particular child. So similarly, in January, these 2 services will be implemented, and they're the last of this bundle of 6 services: youth peer support and training and crisis intervention. So youth peer support is for a young person between the ages of 18 and 30, can be a support to a youth from the age of 14 to 21 to really learn what it means to have a mental illness, to have some challenges, to navigate the system and begin to make decisions about their own care as they reach adulthood. So, and that youth peer is somebody who has had experience with their own illness and navigating the system. Crisis intervention will be a 24/7 response available across the state so that people can call in crisis and get their needs met in terms of where's the best place to turn in those moments of crisis. So how can you get these services? You need to find a CTSF provider, and a child's managed care plan can certainly be a help with that. If a child is already connected with a health home care manager, that care manager can assist in finding a provider, certainly talking to the local SPOA coordinator, and on Department of Health's website, you can also Google designated CTSF provider, and you can do a lookup search by county of who's designated in your particular county. In order to get the service, there does need to be a recommendation that is somewhat like a prescription, and like I said, that's a clinician, or it can be facilitated through primary care, and then the provider determines whether they're actually eligible for CTSF. So the other piece of the transformation that began to happen in April of this year is that New York State, across these 5 state agencies, had 6 home and community-based services waivers from the federal government, and each were developed with particular target populations in mind, and each target population had an array of benefits available to them if they were accepted into the waiver. So if you were a child with autism and ADHD, you have to make a decision about which array of services made most sense to your family. So do you go through the door of OPWDD or to the OMH waiver? And really that was not an efficient way of looking at children and families with complex needs, cross systems, service access, et cetera. So starting in April, all 6 of the waivers were collapsed into one statewide children's waiver, and there is an array of available services to everyone in the waiver, regardless of the primary service system you may interact with. And really the goal of this waiver is to keep children and youth with complex health and mental health needs out of hospitals and residential settings, and then helping those that are in hospitals or residential settings transition back to their homes with a set of supports and services to help them stay there. And really supporting the children and families as they work through their own goals to be successful in all domains of their life. And these services should be individualized, flexible, and really based on the strengths of that individual child. So who can get HCBS? There's a long laundry list of the different combinations of conditions or disabilities that are eligible, but generally it's for children under 21 who are enrolled in Medicaid and meet the threshold of needing a higher level of care and then meet particular criteria. So they may be a foster care child with developmental disabilities, a child with primary mental health needs, medically fragile child that is also may get services from the developmental disability system or the health system. And so getting this array of services would be really helpful to keeping that child at home with their family. And so this is the entire array of services that are available to all children across all these systems. And having been involved in the early development of this transformation, I hope everybody can appreciate the work in getting 5 state agencies to agree on how they're going to serve collectively New York State's children and agree to a set of services that really are felt to be most helpful to everyone was really a huge lift and a great success in New York State in terms of the future for children's services. There is an evaluation service that's an independent evaluator of whether children are eligible for the HCBS services, and so this is their contact information, and SPOA coordinators can be helpful with facilitating some of that referral, but also schools can make referrals directly to this. I do want to say one of the things that is unique about New York's waiver, and this happens in other places across the country, is that for children who do not have Medicaid, maybe their families have too much income, but they may meet the disability criteria, they could be determined as a family of one eligible for Medicaid without looking at their parents' income. So CES would be involved in that process of assisting with Medicaid eligibility and application as well. Really the foundation of a lot of the transformation that happened in the children's system, or has been happening in the children's system, is children's health home care management. And health home is a care management service to help children with complex needs coordinate all the different providers and services, identify with the family what their needs and priorities are, and determining eligibility for other services. And so that health home care manager is going to work with children and families to conduct an assessment, create a plan of care, and then monitor and assist with that family on accessing needed services. So who's eligible for health home is that children need to have 2 or more ongoing health conditions or have certain single qualifying chronic health conditions such as HIV or AIDS, mental health, those are single qualifying conditions. 2 or more ongoing health conditions could be a child with diabetes and asthma, or asthma and substance use, and any combination. Think of 2 or more chronic health conditions. And then they go through a process for connecting with a healthcare provider if they don't have it, who are the community providers, managed care, and so the care manager is really going to be responsible for coordinating. And there are a number of different ways in which a family can get connected, and those are on the bottom of this slide. So how do you find a local health home if you're not familiar? And I am aware that in some counties, health home care managers have offices inside schools. That doesn't exist everywhere in the state, but certainly from time to time, I imagine by now, most schools have come into contact with the health home care manager. This is how you might go about finding who are the health homes in your community. Each of the lead health homes, and I believe there's 16 that serve children across the state, they then contract with care management agencies who really then provide the services to the children and families. And other resources that are available online, there's some resources on system of care, there's some videos, some training materials, there's some educational resources on the new services for children and families, and a list also of health homes by county. So there's a lot of information on New York State Department of Health's website related to all the things that I've covered. So this kind of brings me to the end of the formal presentation, and I want to leave you with a few thoughts, and then we'll take some questions. Is, again, reach out and look around in your local communities. Who are the local systems of care? Are there existing infrastructures that already meet and they're connected? And maybe schools have been connected at different points in time, but it's really a good opportunity. You're all experiencing increased mental health needs of your student population, so how can we solve some of those issues together? The other thing is inviting some of these designated new service providers into the schools to present to staff. SPOA coordinators can also come and present during your professional development days, can come and talk to your support teams specifically about really the nitty-gritty information of the referral process for some of these services. And so there's lots of folks out there that are building capacity in their particular agencies for all these services, and certainly can serve as a contact, and many of them have brochures and pamphlets and all kinds of outreach kinds of materials. So that's the end of our formal presentation. If you have any questions related to anything, my contact information is there. I'm happy to take questions, have conversations, to point people in the direction related to system of care services, so please reach out. And please type in questions if you have some, because we have about 10 more minutes. So one person commented that and I'm assuming that the services were really news to this person, and it's good to get this information out. And I think despite providers and the state's best efforts to continue to get information out like this about this array of services, we know we're not touching everybody and that the information's not trickling down to all levels. So we're happy that those of you on the phone, joined us, and there's plenty other information out there on this. Another inquiry is about the difficulty getting services for students that have both mental health and intellectual disabilities, and who provides those in local communities. And that has continued to be a challenge throughout New York State. And I think some of the benefit of the 5 state agencies going through this process of planning and implementing these services is that it opens up a lot of avenues and opportunities for conversation and collaboration to better meet those needs. That's not a great answer to say, there's 5 specific services across the state. But there are providers that are becoming more knowledgeable about how do they kind of have their foot in both systems. A question about telepsychiatry being accessible in schools. That is certainly an option. The best way to go about exploring that is to reach out to your healthcare providers and those that have mental health outpatient licenses. Some of them do have equipment that they can share. I'm aware of a couple hospitals on the western part of the state that are working out some licensing issues, but are close to being able to give equipment to a couple schools in rural communities so that telepsychiatry can happen and families can access psychiatric services via telepsych and using a computer on site.
There also seems to be a question about accessing SPOA if a child does not have a current diagnosis.
Yeah, one of the nice things about the other licensed practitioner service, so assuming that a particular student has Medicaid, they can be referred to a other licensed practitioner. They can conduct an assessment to lead to diagnosis. That service, the first 3 visits are really intended to be that assessment and engagement. So even without a diagnosis, they can begin to engage in services and get clarity around a diagnosis.
And that's that Children and Family, CTSF.
Yep.
Acronym, right?
Yep.
And I think, too, Angela, as I was listening to you, we'll make sure that we pull some of the specifics out of this and get it on our website so that within the educator section there'll be some resources about who exactly to contact and some of the links for where they can find those providers.
Great question. Is SPOA only available to children who have diagnoses? Absolutely not. SPOA coordinators serve as really a warehouse of connection and information, and they're happy to connect folks. Even if children don't have Medicaid, there are resources in communities for non-Medicaid youth. Private health insurance covers some services, and that is also some dialogue that we're having in terms of parity in the private health insurance plans.
This is a really good question about families either don't trust or don't utilize county mental health, and it looks like there's only and concerns about whether or not they can access a pediatric psychologist, psychiatrist. Am I reading that correctly?
Yeah, this would be a perfect area if a family is reticent to access mental health services, but the school clearly sees that there are needs that are beyond what can be provided inside the school. This would be a great opportunity to connect a family with a family peer, and to really talk about what is that like, what are the issues or the barriers that particular family is experiencing in terms of accessing mental health. Maybe there's some information. Maybe they just need some understanding of what can and cannot happen in the context of that service, or they can help them find another provider that might better meet their needs. And so that's a really great opportunity for a family peer to be helpful in that kind of a situation.
How about any grants or pilot opportunities that schools should be aware of?
Related to system of care, there are several, so Onondaga, Chautauqua, Cayuga, Rockland, Herkimer, and Otsego all have system of care projects, and schools certainly could get connected with formal projects, but there are other infrastructures across the state that certainly have been working on system of care. It's just a matter of finding those folks.
And then beyond systems of care, I know we've been in contact with a lot of folks working with BOCES for a co-service, and that has been able to fund either some school-based mental health or coordinator-type positions that can help schools access services.
Yeah, and the other, in addition to SPOAs, I do want to point out the OMH field offices. There are 5 across the state, and again, you can Google OMH field offices online, and a school could certainly reach out and ask to speak to the OMH children's coordinator, and that would be another person to consult with to get information. And I appreciate somebody mentioned that a SPO coordinator participated in the CSE meeting, and they were really helpful and a great resources. The school was particularly planning around a specific child.
And that they were able to join via phone. So sometimes it's not practical or not possible for them to be there in person, but that's certainly an option.
Do counties have a choice about offering everything on the array? There's probably many different answers to that question. For the CTSF array of Medicaid services, that's a state plan service, and so we're obligated by the federal government to make sure that that array of services is available everywhere. And as I said, some of those services are still new, so the providers are still building capacity. So it's not really the county delivering or providing that service. The other things in that array of what's available in the Office of Mental Health Children's System, the regional office would also be, the OMH field office would be a place to reach out to talk about just what's available and in their particular region.
And then there's a question about the family peer support. Would one example be parent to parent?
Yep.
Yep.
So the Office for People with Disabilities Services has funded parent to parent. The Office of Mental Health has family peers in our regional offices. There's also Families Together in New York State. Youth Power has regional peer advocates across the state, and then certainly in individual counties. There are different peer organizations that provide services. And looking at, and many of them do provide support groups or an individual services in terms of helping people access services. So somebody asked that you're in one of the counties that has, that I indicate has a system of care grant. Email me. I can connect you to who that person is, because there is a coordinator for those grant programs in each of those 6 counties.
And that does seem to be our last question. We'll just pause one moment to see if there's any more. But once again, Angela, I really want to thank you for taking the time to do this and presenting it in a way that those of us who are not deep in the mental health care system can understand. So we hope that this is helpful for schools. Again, the recording will be made available, the PowerPoint, any other information that we can get that would be helpful. I can speak from the Resource Center. We will be sure to include some of these specific links readily available, like to access the SPOA, HCBS services, the DOH link for the CTSF array of services, all those lovely acronyms, and the CES for eligibility. So thank you very much, everyone, for joining us, and thank you, Angela, so much for your support today.
Thank you. Have a great rest of the week, everyone.